Golly.
I want candy. All I'm saying is, I'm not saying anything. Okay. Tetracyclines and aminoglycosides. So tetracyclines says are effective against certain bacterial strains that are resistant to some others. So it's just another type of antibiotic. Aminoglycosides are used primarily for infections caused by gram-negative enterobacteria. Gram-negative, okay, whenever you hear that word, what it's talking about what it's talking about is how it stains. So, like whenever they try to, if y'all ever heard the word culture, like if they try to culture, like a urine culture or blood culture, no,
Not like that.
Okay, so what they do, one of the things that they do is they can take urine or blood or sputum, whatever it is, and they take it, they swab it, and then they swab it into a petri dish. And there's actually a certain, like a whole procedure in how you do that. So they swab it in there, and then they stick it in an incubator for 48 hours. Take it out, and ultimately, okay, blood and urine should be sterile, so they shouldn't grow anything. Yeah, there should be no bacteria on there.
It starts getting some stuff.
But if it grows something, then they test that, they look at it under the microscope and determine what it is. Well, when you look at bacteria, you stain it. There's certain types of things that you use to stain it so that you can actually see it. And a lot of times it's purple. Like we looked at something under the microscope. Oh, we stained. Remember when we did our cheek cells? We're looking at epithelial cells, okay, and we stained them. Okay, that's what I'm talking about. So certain parts of them stain. Well, certain bacteria stain. Some of them won't take the stain. This is gram-negative, so it will not take gram stain. Oh. So, anyways, but these aminoglycosides, so they're used for that specific type of bacteria, but they have a really high toxicity, so you have to be really careful with them. And it makes sense because probably if they're gram-negative, that means they probably have some kind of shell around them that makes them where they won't take on that stain, so it might be also hard for antibiotics to break kind of their outer shell, if you will, to get in and actually kill them or inhibit them. So it makes sense. Okay, examples of this are amikacin, gentamicin, streptomycin. Those are kind of the more common ones on here that I've seen before. Neomycin, I've seen that one too. So these are given, they're IV or IM. I've seen strep given IM before. Maybe some of the other ones too. And they may be oral too, but I've seen an IV, generally speaking. But very potent antibiotics. Okay, fluoroquinolones may be useful in people who are allergic to penicillin. So they're more broad spectrum. If people are allergic to penicillin, and a lot of people are, okay, then they can take fluoroquinolones. And usually the suffix, did y'all look it up? Did y'all see it the other day for fluoroquinolones is fluoxacin. So, like we saw, that was on our thing, right? Mm-hmm.
I knew that was.
But it might say quinolones. Sometimes it's shortened to quinolones instead of fluoroquinolones. Oh, okay, those are the same. So some examples of this one are ciprofloxacin. Everybody's heard of Cipro before. You've probably taken Cipro before. That's a very commonly prescribed drug also. A lot of people take it for UTIs. Sometimes they take it for respiratory infections and all that. Nitrofurantoin is for Adantin. That's a UTI med that's used a lot. It's another one. Miscellaneous antibiotics. Oh, they're not listening. Going in the wrong direction here. Miscellaneous antibiotics, chloramphenicol, clindamycin is another one that's very commonly prescribed, especially for like skin. And then metronidazole. Okay, you need to know that one. The brand name for that is Flagyl, Flagyl. That's that one I told y'all I got mixed up that time. I got it mixed up with mebendazole and metronidazole. It sounded a lot alike, and so when I looked at them, I got mixed up. It happens, doesn't it? So, anyway, metronidazole is Flagyl, and that is one you definitely want to know. You'll see that on there. Flagyl gives off like a metallic taste. Whenever you take it, it's like makes everything taste kind of metally. A lot of times it can be given for like stomach infections too. It's also given for like pelvic inflammatory disease. Okay, antiviral agents. Antivirals obviously used to treat viral infections. What suffix do they have?
Fire.
VIR, yes, usually. Okay, so those are usually pretty easy to pick out. They act by influencing viral replication. So depending on, and y'all probably may not remember this from anatomy, but y'all remember how, you know, DNA separates, RNA comes in, kind of takes the blueprint, RNA leaves the nucleus, goes out, and then it creates proteins. You know, everybody remember that? So this actually influences how that replicates and how it builds proteins and so forth. So it tries to go in and mess with the DNA and RNA. The problem is, see, with like with HIV, the reason they can't get rid of it is because HIV actually plants itself into the person's DNA. Okay, and then so when their DNA replicates, then it replicates, you know, with that and with it. Yeah. Okay, so antiretroviral agents effective against HIV. Now, when I say effective, that means can keep it from getting worse. Okay, it's not going to heal them. Nucleotide reverse transcriptase inhibitors, and you'll notice some words in here. I know these seem like foreign, but like transcription, okay, is part of that process, that protein making process that we talked about and all of that. So that's kind of, you know, but anyway, so you don't necessarily need to know specifically how each of these work. You just need to have an idea of what they are. Antiretroviral. So retrovir is one that you'll hear a lot. And these don't have VIR in them. They still have these in them, but the brand names do. Those are the ones that retrovir is the one I've seen most commonly on Pass Assured anyways. Highly active antiretroviral therapies. As antiviral agents are being used either alone or in combination to treat HIV. And so this involves a combination of 3 to 4 drugs. So typically people who are HIV positive are going to be taking lots of medicine. Not to mention the fact that they're going to have other infections and stuff too because of how it affects their immune system. Okay, antifungals. These are can be used for a systemic fungal infection, maybe a local fungal infection, or topical, like athlete's foot. That's a topical fungal infection, or like a fungus, toenail fungus. Okay, does anybody else get really creeped out by the commercials where those like germs get underneath your toenails? That really grosses me out. And they're like, I don't know. Anyway, that's it on here. Okay, let's look at this. Let's look at this little booklet paper thing that we have. Okay, page. And I like this, and here's the reason I know that this makes for you guys to have a lot of info, but I like this one because it's short and sweet for every type of thing, and it gives really good examples of medications that you need to know. That's one thing I feel like sometimes Pass Assured, you know, it's kind of hard to determine what meds you need to know and what not, and I think this is really good. So page 29 is where these start. Antibiotics, so sulfonamides is where these start. So I'm going to go back over some things we've already talked about. These are your 29. Okay, so sulfa drugs, and we won't worry a whole lot about mechanism of action unless it's specific. But look, common indications: UTIs, otitis media, which is middle ear infection, ulcerative colitis, so that would be in the belly, and then lower respiratory infections, so bronchitis, those kind of things. Adverse reactions, photosensitivity. So that means when they photosensitivity, you'll see a lot especially with anti-infectives. But so people can be really easily sunburned. Okay, and that's a side effect they talk a lot about. I feel like on Pass Assured too in the test. Nausea and vomiting, jaundice, blood complications, or kidney damage. So those are adverse. Now that's not like those are all common, but nausea and vomiting. A lot of people get sick on Bactrim. Special considerations: avoid direct sunlight or use sunscreen. Drink lots of water. And then Bactrim, it says infusion fluids need to be stored at room temperature. That's because they'll, if you get them too cold, it may mess with its like stability as far as giving it IV. Okay, but that sulfamethoxazole trimethoprim is your Bactrim. So that's the one I underlined on that next page. But anything with sulfa in it is going to be a sulfa drug. Now, Silvadene is a cream that sometimes people will take use that on like burns before. Hear that. So those are kind of the two there. Okay, penicillins. Of course, the suffix for these is -cillin. Look at how they work. Prevent bacteria from forming a cell wall. So they keep it so it doesn't form that wall that can't be penetrated by the antibiotics or by foreign something else like our white blood cells. Common indications: abscesses. Everybody know what an abscess is? Like a boil, okay, or you get it in your skin, infection in your skin, or a rising. Sometimes people call them a rising, you know, but usually has a head on it and usually has, you know, lots of infection inside of it. Has to be lanced and packed. Meningitis. Everybody know what meningitis is? Inflammation or infection of the meninges, the layers of the brain, around the brain. Otitis media, pneumonia, respiratory infections, and then prophylaxis. So again, in order to prevent infection for some reason. Adverse reactions: diarrhea, hives, rash. Those are kind of signs of an allergy, which then they wouldn't want to take it anymore. Wheezing or anaphylaxis. So again, that's all. The anaphylaxis, everybody remember that? Like anaphylactic shock. That's your severe allergy that causes respiratory problems and everything else. Diarrhea is usually a side effect of most antibiotics. So special considerations: take on an empty stomach with water. Avoid taking it with colas or juices. Reconstitution can be stored at room temperature but will last 14 days if refrigerated. Augmentin should be refrigerated and will last 10 days, and ampicillin 7 days, or 14 days if it's refrigerated. So it'll last a little longer that way. And that's something else that you'll see online is the how many days, you know, it's good for. Usually it's 10 or 14 as far as oral medicine goes. No, IV medicine is different. So some examples: amoxicillin, and I didn't star that one, but that's definitely one that you'll see. I mean, hopefully we've all heard that one before, amoxil. Ampicillin is Omnipen. That one's pretty commonly prescribed. I mean, all of these you see some. And then penicillin Vetids. See that one at the bottom, or next to the bottom? That one you'll see a lot with like dental work. You'll sometimes see that. It'll say they had a tooth out or something like that. Okay, cephalosporins prevent bacteria from forming a cell wall. Same kind of idea. Dental work, heart and pacemaker procedures, orthopedic surgery, pneumonia, upper respiratory infections, or sinus infections. Same side effects as penicillins. Look, 10% of the population may have a cross-sensitivity to penicillin. So those two are kind of together. If they're allergic to one, they could very well possibly be allergic to the other. Reconstituted should be refrigerated, last for about 14 days, except for the other one that's 10 days. So most of them, like I said, 10 to 14 days usually. So examples of these: Ceftonir is Omnicef, Cefepime is Maxipime, Cephalexin, Keflex. So those are all, they all have that Cef in them. Keflex is one you'll definitely see. I will feel like you'll probably see that one. It's pretty commonly prescribed too. Carbapenems, if I'm saying that correctly again, Monobactam. So these are for gram-positive and gram-negative bacteria. Same as penicillins, but there's a higher risk of seizures with these. These are, I don't see these a whole lot on there. Azactum, I've seen that one before, but other than that, these are kind of, they're not as often prescribed. Tetracyclines. So look, they inhibit protein synthesis in bacteria by binding the ribosome, so they won't let it replicate. So indications for these are acne, chronic bronchitis, Lyme disease. What's Lyme disease caused by? Do you know? Ticks. Initially, at least. Walking pneumonia, prophylaxis for traveler's diarrhea. So GI, adverse reactions, GI upset is basically what that means. Nausea, vomiting. Photosensitivity, this is a big one for docs, for tetracyclines. Photosensitivity is something that you'll see. Special considerations: may bind to antacids and dairy products, and then it won't work as much, so they don't want to take those at the same time. Tetracyclines should be taken several hours apart from antacids and dairy products, like I just said. They should not be taken by pregnant women because of dental birth defects. Look at this one. This is another key part. I underline it here. Children younger than 9 years should not be given tetracyclines. Taking it can actually, and it doesn't say this in here, but I think it can change. I think it like yellows their teeth, their permanent teeth. Let me. I can find it. If I remember correctly, let me make sure. Oh, I don't see it on here. I'll look that up in a minute. I think that's one of the main reasons, is it makes like causes their teeth to yellow, their permanent teeth, even if they haven't come in yet. Taking expired tetracycline may result in toxicity and possibly death. Stable if it's injected. It's stable for 12 hours. Should be protected from light. This is the one I was telling y'all that got stuck in my esophagus, that ulcerated my esophagus. This is what I was taking, was doxycycline. Should probably take it with water. But definitely, that's a key thing. You'll see that doesn't need to be taken in kids, okay, less than 9 or 8 and under, and photosensitivity are two big things that you'll see. I've seen them online. Doxycycline is probably the most common one on here, but any of these you could see. So cycline is kind of your clue that they're tetracyclines. Macrolides, we talked about these a while ago. Inhibit protein synthesis by combining with ribosomes, kind of like the other ones. But look, pulmonary infections, chlamydia, which is an STD, and then Haemophilus influenza, which is another bacterial infection. Pulmonary infections, like I said, is probably what they're most commonly prescribed for. May cause GI distress, nausea, vomiting, diarrhea. Patients should take them with food. Clarithromycin may leave a metallic taste. First dose is a loading dose. That's when I told you it comes in a little pack, like a Z pack. You take 2 the first day. It's called a loading dose whenever you take a little bit more the first day. And what that does is that kind of ups it so that you get, like it quickly gets up to the therapeutic level in your body so that it can start working. Reconstitution, good for 24 hours as far as injection goes, or 10 days. Erythromycin. Where did it go? Oh, it didn't say erythro. I was like, why did it say that? Clarithromycin does not need to be refrigerated after reconstitution. Oh, it does say erythro. There it is. Like I said, with the Z-Pack. Oh, here they are. I was like, where are the rest of them? I was looking above instead of below. Did I get confused? Sorry. Azithromycin, clarithromycin is Viaxin. Erythromycin is another one that you'll see. So mycins are your macrolides. I think I just smushed all this together in my head. I missed the macrolide thing. Anyways. Ketolides. So I have seen Ketec on there before. It's not as commonly prescribed as some of the others, but bacterial infections for lung and sinus, so respiratory. Quinolones usually end in fluoxetine. Bone indications are for bone and joint infections, dental work, infectious diarrhea. Sounds like fun, doesn't it?
Oh, yeah.
URIs, which is upper respiratory infections, and then UTIs. So nausea, vomiting, joint swelling, dizziness, are your adverse reactions. And then a couple other things, phototoxicity again, lots of antibiotics have that. Should not be prescribed to individuals younger than 18 because of possible tendon rupture. It can rupture their tendons. Okay, I know that sounds really weird, but it is. That's one of the adverse effects, and that's one that you need to know. Tendon with quinolones can cause tendon rupture. I think that's it. Okay. Examples of these is your Cipro, Levaquin. That's probably why I haven't had Cipro before. I said that earlier. That would not be good. Levaquin is another one that's frequently prescribed. Those two I have starred there. I'm not saying that you won't see any of the ones that I don't have starred. I just, when I went through, I starred the ones that I've either seen on this before or that I know are pretty commonly prescribed. Okay, streptogramins. So these are for gram-positive infections, including, I'm not sure how to say that one, but vancomycin and methicillin-resistant infections. So VRE and MRSA. Everybody remember those? Talked about nosocomial infections. These are the two that are resistant. So this would be a pretty potent drug if it can get rid of those. Adverse reactions: nausea, vomiting, joint swelling, infusion. What that means, see, it says an adverse reaction site at the site of infusion. That means if they're getting it by IV, like it can really irritate the skin and tissue around where that IV is. A lot of times if people have something like VRE or MRSA, they are on antibiotics for a long time. We're talking several weeks. So usually they won't give those antibiotics through just a regular IV. They'll usually put in a central line or what's called a PICC line. PICC line stands for peripherally inserted central catheter. So a central catheter, central line, is like an IV, but instead of going in and having that short kind of catheter on it like you would have in your arm, the catheter actually, usually a central line, they either go in through the veins in the neck or up here in the chest, and the catheter is longer, and it actually goes to like right before the veins enter back into the heart, right before it's at that right atrium. And so it will actually give medicine, I mean, it just gives it, it's right there at the heart, so it goes on. And that helps to prevent some of the issues around like where an IV would be, because IVs don't last very long. They usually only last 2 to 3 days. And so if they come out or dislodged and that medicine gets into like the subcutaneous tissue or the muscle, I mean, it can cause some damage.
So the peripheral one that starts here and it goes all the way to the heart?
Yes, so a PICC line or peripherally inserted central catheter is put in, usually it's like up here in the arm. And so it's put in here, but the catheter on the inside actually goes all the way up to the right side of the heart. It goes to the same place a central line does. So it's a little bit less risk for infection as far as, I would say less risk of infection.
It's like it just.
Yeah, I mean, I guess it is technically less risk of infection.
It's like you couldn't do anything. It's like even if you moved or whatever, everything moving here would.
I mean, you can move. They make it, because you would have this, you may have this for 2 or 3 months, you know. So yeah, you can move. It's actually a lot more, it's a lot easier to live and function with that than it is one up here, you know. So, but that's a sterile. A few things that come along with having a PICC line is it's not like an IV. IV is, I mean, obviously you want it to be sterile going in, but it's not like, you know, it's not like this big sterile procedure you have to prep for and all that. You know, you can just use regular gloves and do it. But whenever you're doing a PICC line, even when you're just changing the dressing, it's a sterile procedure. So when you take it off, you have to wear a mask so that you're not breathing in on it, because that catheter goes like directly to your heart. So if that catheter gets infected, it's a good chance that your heart will too. You can get like carditis.
That's not good.
So anyway, so a lot of these medicines that would cause horrible, you know, like a horrible effect, I can't think of the word, at the site of where it's going in, a lot of times are given through like a central line or something else. Look, IV lines must be flushed with D5W, so dextrose, that's dextrose 5% in water. Okay, that's normally, you kind of, normal saline is kind of like your common, what you use to flush everything. That's your everyday IV. But this one can't use that. You have to use a special drug. So it's labeled that. So, look, it should not come into contact with saline or other medications. Aminoglycosides inhibit bacterial protein synthesis by binding to ribosomal subunits. So again, it inhibits them from creating proteins, which are going to make it work. They make it function. So indications, these are for life-threatening infections, sepsis, which is kind of like systemic infection all over, and then immunocompromised patients, so people whose immune systems are compromised or down. Adverse reactions, look at these. Nephrotoxicity, which is what? What is nephro? Kidneys. So kidney toxic, ototoxicity. No.
No, that's ear.
Ear. Tinnitus, which we just learned about, right? Ringing in the ears. And permanent deafness. Okay, so these are not ones you want to play around with. Special considerations, the dose needs to be adjusted for each patient after the first dose. So they give them their first dose, then they're going to do blood work and check and see how their body is reacting to it. How much do they still have left in their system? How much do they not have left? Once per day dosage has tendency to reduce toxicity, so they try to get it where they can just do it once a day. These are kind of like look at these. These are your amikacin, gentamicin, neomycin, streptomycin, tobramycin. So these are all the ones I talked about earlier that are pretty potent. Okay. You just don't want them to get to a toxic level, and those things can occur. Cyclic lipopeptides, this is not even one that I've even looked at before, but look, used to treat complicated skin infections and aerobic gram-positive, so not used very often. Miscellaneous antibiotics, clindamycin, this one's pretty frequently prescribed, or Cleocin. It's for acne, dental prophylaxis, for people who are allergic to penicillin, anaerobic pneumonia. Everybody know what aerobic means? Aerobic has to do with oxygen, like if it needs oxygen or doesn't. Anaerobic is without. It can function and live without it. Lost my spot. Bone infections, female genital infections, adverse reactions, bloody diarrhea. Not a fun one either. Okay, metronidazole or Flagyl. Like I said, this is one that you need to know. Destroys part of the bacteria's DNA nucleus. Kind of weird, DNA nucleus. Maybe it's DNA in the nucleus. Anyway, indications: trichomonas infections. So that's an STD. Amoebic dysentery. So that's like amoeba infections, like you might get by drinking bad water. Okay. Like I had Giardia one time when I was in Ethiopia. I was so sick. I had this ridiculously high fever. It came with vomiting for 3 days, horrible diarrhea for 3 days. And that took Flagyl, which causes diarrhea too, so it doesn't really help with some of that. But anyway, and some people don't get that metallic taste. It kind of depends on, I don't know, it's weird. Some people get it, some people don't. But anyways, definitely has a metallic taste. Diarrhea, rash, and an antabuse-like reaction when alcohol is consumed. Okay, this is a big one. You do not want to take Flagyl with alcohol. Antabuse is a medication that they give to people who are recovering alcoholics, and what that does is when they take that antabuse, if they drink alcohol, it makes them violently vomit, violently sick stomach-wise. So if you take alcohol with Flagyl, it has that same reaction. Okay, violently sick. So that's a big one with that. Alcohol and Flagyl don't mix. An antabuse-like reaction results in blurry vision, confusion, difficult breathing, hot and scarlet face, intense throbbing in the head and neck, and chest pains. Take with food and avoid any form of alcohol 1 day before, during, and then 2 days after. Pentamidine. This is another one. It's not given very often. Zyvox, I've seen that one given at the bottom. So look, it's for MRSA or VRE, so another pretty potent one. Vancomycin is a very commonly prescribed IV medication in the hospital too, and it's another potent one. It's ototoxic and nephrotoxic as well. Dialysis patients, endocarditis, or staph infections. It's kind of like the go-to for staph infections. Y'all probably heard me talk about vanc before. Look, potential for overuse prompted the CDC to issue specific guidelines because people were using it all the time. People get staph infections all the time. A lot of times, another thing to add there with vanc is people can get what's called red man syndrome. And if it's given too quickly, then their whole body turns red. So that's something that's like a side effect, I guess. But they usually want you to slow it down at that point if they're doing that. It's a reaction. So they'll say, instead of giving it over an hour, IV-wise, you might give it over 2 hours. Antifungals. So fungus, it says a single cell organism without chlorophyll. Okay, so it's not a plant. Chlorophyll will make it a plant, right? That's what makes plants green. A cell wall is present and reproduction occurs by spores. Fungal infections occur when the immune system has been compromised. Now, we're not talking about skin infection, but if you have some kind of systemic fungal infections, it's usually when your immune system is down. Adverse reactions, liver toxicity. Therefore, liver function tests are recommended. So they're going to do LFTs, is what that's called, liver function tests. GI distress, photosensitivity. Special considerations, these may be used as either topical or systemic agents. Pulse dosing is recommended for nail fungal infections. So you give it for a while, and then you start it up again. Consuming a cola before taking itraconazole is recommended. It's weird how they figure some of these out. But big ones here, amphotericin B. Seen that one. I didn't. Clotrimazole is one that's given. Fluconazole. But anyways, azole is kind of your clue here. But that amphotericin B is one that you may see too. I didn't put that on there. Nystatin is commonly prescribed. That's what anytime my kids have had like a diaper rash that turned into like a yeast diaper rash infection, which happens sometimes when they take antibiotics. Nystatin is usually what's recommended. Lamisil, that terbinafine Lamisil, that's the one I feel like you see the commercials for with the toe, with the little toenail germs.
Sure.
I think that's the one. Antivirals. So indications, cytomegalovirus, CMV, genital herpes, herpes simplex keratitis, herpes zoster, which is shingles, influenza. Influenza, of course, is a virus. Organ transplants, varicella or chickenpox. Headaches, nausea, vomiting, diarrhea, constipation, renal disorders. Oral products should be taken with plenty of water. When acyclovir is reconstituted, the injection needs to in 12 hours. So acyclovir, pretty commonly, I say common, you don't really give antivirals very often, okay, because normally your body will take care of it on its own, but sometimes it doesn't, okay. Viral meningitis, if you have something like that, they're going to do their best to give you antiviral meds. But, you know, for your common cold, it's just your body's got to figure it out. Tamiflu, notice that one is on here. Okay, that one is for the flu. Tamiflu. Include you in there. Most of these have VIR in them, though. You can tell. Antiretrovirals. These are your meds for HIV, like we said. Again, Retrovir is the one to look at with that. Keep going on those. I think that's it. Actually, I'm going to whiz through these. My suggestion for you guys in studying for these is maybe to even make flashcards and just put like some of the key things on them so that you can go through and look at them, you know. Cephalosporins on the back, you know, obviously they're all going to have ceph. Put those drugs that I starred on there You know, you don't have to, mechanism of action, you don't need to know, but you need to know major, any side effect that's out of the ordinary, that's kind of special for that one. Phototoxicity is big time, almost all of them have some kind of phototoxicity. But some of them that I underlined, I know that it will ask you specifically, like the tetracyclines. Other than that, just, you know, anything that stands out to you about that medicine, that's kind of what you want to focus on knowing. Okay. But that, like I said, I like this because it's kind of condensed and it's kind of got it all right there, the meds that you can expect to see. But look for clues on the medicines. You know, they kind of sounds like viral. It's probably antiviral medicine. But, you know, the rest of them have those suffixes, like cephalosporins have ceph in them somewhere. It may not be a suffix, but it's in there somewhere. So look for those clues, you know.